Welcome to Thoughtful Thursdays. Today we have with us Dr. Salam. He's a urologist and we're going to talk about his field. Hello, Dr. Salam. How are you?
Good. How are you?
I'm great. Very honored to have you with us here.
It's my pleasure.
So can you tell us a little bit about your field, what you do?
I'm Salam Alhasani, consultant urologist in Mediclinic. We, as urologists, we are dealing with different types of urological diseases, and we do different types of surgical procedure for urology. But if you want to say, we have special interest in men's health and prostate diseases.
Okay.
I'm also adjunct clinical prof in the university.
All right, Dr. Salam, you mentioned prostate diseases. Is that something which is very prevalent in the community? Do many people have prostate disease?
As you know, prostate is a man disease. Okay, so prostate, only men that have prostate. But usually most of the people, when you speak about prostate disease, it immediately was come in their mind, prostate cancer. We try in many actually interviews before even that, we try to get rid of this idea that prostate is not only prostate cancer. If you go actually for prostate cancer as a percentage from whole prostate diseases is very small percentage. But the majority of prostate diseases can happen, which is, we call it benign prostate enlargement. And this can affect men in their middle age. And also some other inflammatory or infectious diseases which can happen in young age group.
I've heard that if a man lives long enough, he will have a benign prostate hypertrophy, like an enlarged prostate. Is that true or is it not true?
Yeah, sure. Actually, we are hoping every man will live long enough. So, prostate, there's a term in medicine, we said, when you start to have a white hair, okay, so means that the prostate starts growing up. Okay, this almost in around mid-age or 50s or late 40s, the men will start have some sort of prostate enlargement. And when you have the prostate enlargement, you start to have some urological, urinary problems, some difficulty in urination. You feel more urge to go to the washroom. You need to go more frequent. You feel he didn't empty the bladder completely. So at this point, actually, we ask most of our patients that you need to consult urologist. You need to have proper assessment for your prostate. Of course, there are some other reasons we need to have also proper assessment for prostate.
Is there anything a man can do to delay this process or to prevent the prostate from becoming problematic?
We cannot say we can prevent. Let's be very clear. We cannot say prevent. We can say we can delay a bit. We can say we can minimize the severity of disease or symptoms. But we cannot prevent it totally, because this which we are speaking about, prostate enlargement, it's part of aging process. So we cannot stop that completely. Till now, science is growing, everything there is new. But in general, healthy lifestyle, by all aspects, from food, exercise, all aspects of healthy life will delay that. Because if you go we want to think it in a simple way, because the reason to have a prostate enlargement and disease is part of hormonal changes that happen with men. So if you have a proper lifestyle, healthy lifestyle, and you keep yourself fit with, in adulthood age, with proper hormonal status, you will delay that for later stages.
Okay, that's. This is encouraging for men to
hear. Yeah. This is why you see most of athletes, the pure athletes, you see their problem with the prostate is almost either they have mild symptoms, very low symptoms, or they have it at the late stages.
Okay, and let's say what symptoms should make a man worried? You mentioned a few symptoms.
Yeah, thank you. If you want me to classify it, let's say in scientific way, we classify it actually into two types. Symptoms that related to difficulty in passing urine. So usually man will go to the washroom, to pass urine immediately. And here I'm always ask the patient, when you go with your friends and you go to the mall and you go wash to the washroom, and you feel you delay, you take more longer time than other your colleagues. They said, yeah, I'm always the latest. So this means that he has some delay in passing urine, what we call it hesitancy. And you see the urine's weak, need to push a little bit to pass the urine. And also the urine doesn't come in one go. It comes interrupted on and off and so on. And one of the most important alarming sign is when you start to have wake up frequently at night to go to the washroom, and 2, 3, 4 times, and you pass little amount. This because if you want to compare that with the people who has diabetes, sugar problem, they will go to the washroom at night, but they will pass large amount. Here in the prostate, they go, but they pass very little amount and go to sleep and wake up again and go to pass urine again.
Okay, I think it's like common knowledge among the population that pumpkin seeds are good for the prostate. Is this true?
Yes, totally true. It's totally. I see in treatment of prostate, mainly it's one state about prostate enlargement and also some sort of prostate inflammation. What we call it the phytotherapy or herbal therapy is very well known and standardized, and being scientifically proven is very effective. And we are using it on our daily practice. And patients actually are happy, and it has really good effect. But we want to be very clear. It's good for healthy prostate, but it's not always the main treatment. Again, you need to be properly evaluated to see this herbal therapy or phytotherapy is enough for you, or most of the time will add something else to make your symptoms better and you feel better, go to the urination easy and so on. So it is good, but it's not the only treatment.
So I shouldn't go and buy stocks in pumpkin seeds?
It is not. There are capsules. No need to buy a pumpkin seed. There are capsules. There are different formulas actually, and these are it's scientifically proven, and many of them are FDA approved, and is being packaged in a proper way, in a proper dose, and it is there in our what you call it in guidelines, in our books. So it is there. So why you take a pumpkin seed? You can take capsule and that's it.
Because they taste good.
Okay.
They're nice.
Okay.
So is it that the capsules are more effective than the actual?
No,
seeds?
the concentration here is well. The concentration you say what we are giving usually give around 320 a day. Okay, this is scientifically proven is the ideal dose to have a proper effect on the prostate.
So what should, let's say, if you're a man who's around the age of 50 and you have very mild symptoms, does this mean you have to just take care and do a little bit of phytotherapy and eat some pumpkin seeds, or should you go to the urologist and have some tests done? And if so, which tests would you recommend?
Perfect. See, first of all, I'm always saying we don't scare people about the prostate cancer, but we need to know that there is some disease, we call it a prostate cancer. And you mentioned age of 50, which is the age most of men, they have to start screening for a prostate cancer. Why we have to start screening for a prostate cancer? Because prostate cancer is a bit common disease. It is 1 in every 9 men, okay, then may have prostate cancer throughout of their life. I'm not saying 50 years, throughout of their life. So it's a good idea to screen for prostate cancer. Second point, if you diagnose the prostate cancer at early stages, it could be curable. So you can treat it, whether surgery, other sorts of therapies, and you get totally cured from that disease. From age of 50, then any man, regardless, even if they don't have symptoms of prostate, you don't have difficulty in urination, you are totally fine, you don't feel any problem, still, you need to visit the urologist at this age and to find out what's going on with your prostate. And simply, this is just simple clinical examination, some blood tests, maybe a scan, yes or no. It depends on the clinical evaluation, and that's it. And then your doctor will tell you need to go next year or 2 years after, it depends. But people who has a family history of prostate cancer, especially strong family history from first degree relatives, 1 or 2, they have to start earlier.
And are there also advanced tests in evaluating the prostate?
If we suspect significant prostate disease, and mainly if there is any suspicion of prostate cancer, we'll do simply an MRI scan. MRI scan will give us, especially with the latest 3 Tesla scan, will give us the clear image of the prostate, and most of the time will show us if there is any lesion. And the advantage also of MRI, we can, if we need to take a sample, we'll take it with MRI guidance now. So we don't take random biopsies as we did before. Now we take a biopsy with MRI guidance. So it will be more precise, and we can diagnose it and easily at earlier stages.
And in the treatment of the normal prostate enlargement, are there any new techniques that you would like to share with us, like new developments?
Prostate enlargement or benign enlargement of prostate, there are different treatment modalities. If we go for treatment modalities, first maybe we'll go with no treatment. As we mentioned in the beginning, we'll tell the patient pumpkin seeds, herbal therapy just to keep your prostate healthy, and that's it. Depends on evaluation. Or medical therapy, some tablets to help the patient. And now the latest is the minimally invasive procedures. We have all these facilities in our center. These including what we call it steam therapy, which is to give some steam to shrink the prostate, and is very effective, very safe if it is done for the proper patient in a proper way. And there is something we call a temporary device, just put device inside to open the prostate, and then we remove it in a week time, what we call it item procedure, and is also very effective. Putting some clips to open the prostate, doing some sort of laser therapy for the prostate, or the traditional treatment, and in addition to the robotic procedure for the benign enlargement of the prostate. All these procedures are effective, but the common question that the patient is say, I want to do steam, I want to do laser. It doesn't work honestly in that way, because it's each patient, we need to evaluate him in all aspects, from his age, prostate volume, other disease, fitness, so many factors. Then accordingly we'll tell him this is the ideal procedure for you, this or that. So it's not always one procedure fit for all people, but this is the common things that come. And the good thing I can say in our center we have all. So ideally, when you go on center, you have all the facilities, all the procedure, and the surgeons are expert in most of these, then they will give you the right advice.
And it might still be that there are like 2 possible options, and then the patient can still choose because he's qualified for 2 different types of treatment.
Yeah, there are 2,
yes.
But it depends. See, let's say, for example, if you do the patient, I will do for you a resume, which is a steam procedure, or I will do you a laser procedure. Both I can do, but in the steam procedure, okay, you will not have immediate results. You need to wait for a month to see the results, but the side effect from the procedure is very low. If you do laser, you will have immediate improvement, but you will have some side effect from the procedure. Here, this is what I'm saying. We have to go and sit and dig in details with the patient and to find out the best option for that patient. Some people, they say, this is not important for me, the patient. They say, this is important. I don't advise. I will advise you for the second procedure. Most of the time, actually, we succeed to convince them, because this is really the ideal procedure for them.
Yes, I'm not surprised that you managed to convince them, because you're a very charismatic personality.
Thank you so much.
And it's obvious that you have a lot of knowledge, and you have all the facilities at your disposal.
Thank you.
I thank you very much for this excellent conversation, and I hope everybody learned something from it. And well, we hope to do this again another time.
Thank you so much. It's my pleasure and my honor. Thank you so much.
Thank you, Doctor.
Thank you.